Well, a warm welcome to today's talk. It's Tuesday, the 21st of December, the shortest day of the year. Now, if there's something good about Omicron, at least it's predictable. We did predict it would become the dominant variant all over the world and in the United Kingdom and the United States quickly. Let's just confirm that now. Now, this is the latest data from the UK here. These bits here are still incomplete. So the Omicron is the purple. Just look at the way it's increased so dramatically in such a short period of time. So basically from the start of December, we've gone from nothing up to about 71.6% in the UK. The official percentage in the United States, as we'll see, is even higher. There it is, it's about 75%. Now, this has gone in the United States even quicker. So 4 weeks ago, there wasn't any at all. 3 weeks ago, 2 weeks ago, last week. Now the dominant variant by quite a long way. This could partly reflect the fact that they've been a bit slower with the sequencing in the United States, but we've certainly got to the point now where it's the predominant variant. Now, the interesting thing to note here, and you've probably spotted this yourself, is a really important point. Let's just look at the American data again here. We see that it looks like Omicron is displacing Delta. So Delta seems to be getting less, whereas in the UK we've still got quite a lot of Delta. So in the UK we've kind of got the worst of both worlds. Although, to be fair, the proportion of the Delta is decreasing. I think we could say that, but we've still got both. Whereas in the United States it does seem to be more of a displacement exercise. So not so good news for the UK there. Slightly better news for the United States potentially. Now, these are the hospitalisations in South Africa, and they are still going up gradually. This data here is incomplete, of course, so some increase. But remember, we've got 7,500 people in hospital in the UK with coronavirus at the moment, with COVID at the moment, mostly due to the Delta variant. So to actually have 9,000 people in hospital who've been diagnosed with SARS coronavirus 2, and in the case of South Africa, we know it's Omicron. So 9,000 people in hospital for a population of 60 million. It's only slightly more than the UK is now, and this is after 4 weeks, just over 4 weeks now, of Omicron in South Africa. So I think this is pretty encouraging data, and it's looking more encouraging day by day. So yes, there's 9,000 people in hospital, but we believe that more than half of these are incidental findings. In other words, they were diagnosed with Omicron when they were admitted to hospital for something else, because everyone who is hospitalised has to be tested, of course, for SARS coronavirus 2, and in South Africa it's virtually all Omicron. So bear in mind that half of these are incidental. And when we look at the number of patients who are actually oxygenated in South Africa, it's under 1,300 patients oxygenated in hospital, diagnosed with SARS coronavirus 2 Omicron, out of the population of 60 million people, and 244 patients ventilated, which is actually a relatively small number. So this is after a month of Omicron now, so it's looking not too bad. Now let's just look at the United States cases here. So here we have the United States, and we see that the cases in the States are... This isn't really showing the data that well in the States. It's a bit out of date. But this is mostly Delta cases here, although we know Omicron's taken over. Now, deaths in the United States have remained reasonably high, unfortunately. And can we see the number of people in hospital in the States? Well, yes, we can. We see it is starting to go down slightly. And by different age groups as well as the total amount. But this is variable depending on the state. So it does depend on the particular state involved. So if we look at, I don't want to waste too much time, but let's look at a random one. Let's look at Idaho. Oh, let me see, it's gone down there nicely. What I was going to show you if I had more time was it's still fairly high in some of the New England states. Hospitalizations are quite high there. Vermont at the moment, for example, is high, with a lot of people off sick as well. So it is patchy depending on the area concerned. So US cases, US hospitalizations, Omicron in the States. Now, this is the latest from the CDC. This is what they've said today. We don't know yet how easily it spreads. So the CDC don't know yet how easily Omicron spreads. Really? Because we've been having a pretty good idea on that for some time now. So I'm not quite sure why the CDC is saying it doesn't know yet how easily it spreads. But let's take some evidence we've looked at. Scientific Pandemic Influenza Group on modelling from the UK. Doubling time is around 2 days, typically about 2.4 days in the UK. So we do know that. So quite why they've said that, I don't know, because we do know that. We also know Report 49, Growth Population Distribution, Immune Escape of Omicron in England, 5.41-fold higher risk of reinfection. So we do actually know a bit about that. I'm not quite sure why the CDC say they don't know at all. Then the CDC also go on to say they don't know anything about the severity of illness it causes. Well, we've just looked at the South Africa data, where it's caused significantly less serious illness. Now, I suppose you could say the CDC is right because they don't know exactly how this is going to unfold in the United States. So that's true, but we do have some pretty good ideas. So quite why they're feigning or not feigning, but saying they're completely ignorant is a bit surprising. London data, for example, from the COVID symptom tracker app, Omicron cold-like symptoms rapidly taking over in London. Top 5 symptoms that we know about from the Zoe app are the first, runny nose, second, headache, third, fatigue, fourth, sneezing, fifth, sore throat. So we do know a bit about the symptoms, and they tend to be these common cold symptoms. Of course, we've also got that data we looked at from Hong Kong, illustrating that the virus probably replicates in the bronchial passages 70 times quicker than the original virus. But in the lungs, where it's arguably more important, down in the alveoli, the virus is replicating 10 times slower. So we do know that, actually. Not peer-reviewed yet, but the data look good. And we also know the South African presentation was described as blocked or runny nose, headache, tiredness, sore or scratchy throat, body aches. So again, we do kind of know that. And then the CDC also say, or we also don't know how well available vaccines and medications work against it. So the CDC don't seem to know that, but we looked at evidence from South Africa again, which shows that 2 doses of Pfizer gave 33% protection against infection with Omicron relative to the unvaccinated, but that was down from 80%. So we do know that the vaccine, 2 doses in protecting against symptomatic disease, goes down from 80% down to 33%. They didn't mention that, because we do know this is all evidence based. We know 70% protection against hospital admissions in Omicron infection in South Africa relative to the unvaccinated, down from 93% with Delta. So again, we see a 93% reduction in protection, down to 70%, at least in the South Africa data. So the CDC are technically right in saying this, that they don't know what it's going to be in the United States. Of course not, but we've got some pretty good ideas, actually. So I'm not quite sure why they are not admitting to knowing slightly more about it, because there should be a fairly intelligent, well-qualified bunch. Anyway, moving on to the UK, COVID symptom tracker data. This is always the most up-to-date, of course. 1.4 million people symptomatic in the UK at the moment. 137,000 new cases. We do believe that the number of Omicron cases is much higher than this, so we must conclude that a lot of the Omicron cases are asymptomatic or minimally symptomatic, and the overall prevalence certainly going up, as we've said, 1.4 million. And the UK official data, well, we are seeing the increase in cases, of course, as we know, this dramatic increase on the week. When we actually look at cases, though, on the day-by-day basis, we do actually see that the increase is high, but it doesn't seem to be going up any further. It seems to be sort of bobbing around this level of 90,000 a day. And when we look at healthcare in the UK, we actually see that the number of patients in hospital on average throughout the country is actually down slightly. Now, The hospitalisations, I did check on this before we started. In London, they were about 200 yesterday, 201, I think. Now they're about 240. So London, that is leading the way in terms of Omicron in the UK. There is some increase in daily hospitalisations in London. But it's not huge. A lot of the problem in London is that there's so many staff quarantining because so many staff have come into contact with the variant. So what the government are doing is they're looking at reducing the isolation period after exposure from Omicron for those that are fully vaccinated from 10 days down to 7 days. And that would immediately, of course, increase the workforce by 30%. Deaths in the UK. Well, thankfully, still going down. Now, of course, we know there's a delay with Omicron. No one's being naive about this, but that's where we are now. So that is some data from the UK. A bit more from the UK here. This is the Omicron UK data from the UK Health Security Agency. That's this site here. So UK confirmed Omicron cases, there was an extra 15,000 in the 15,363 in the past 24 hours. So 60,000 confirmed by genomic testing. S-gene target failure, which is a very good proxy for it, another 18,000 down 143 cases. So we can see officially diagnosed cases in the UK, somewhere over 200,000 now in officially diagnosed cases. But of course, we know the real number is probably that per day. UK hospitals, hospital Omicron patients in UK hospitals with a positive diagnosis of Omicron, 133. And we don't know about the whole country, but we do know in London that half of these are incidental findings. So for all of the UK, 133 people in hospital. Deaths unchanged from yesterday, still at 14. We don't know to what degree the Omicron infection was a factor in these deaths, whether it is of or with. We simply don't know that yet, but we do know that hospitalisations are still relatively low. Now let's just look at some international data as well. Always good to keep an eye on this. So here we have, well, these are new daily confirmed cases. So the United Kingdom going up quickly. Ireland also increasing with Omicron. The United States, the increase is there. So the proportion of Omicron in the United States is already 75%. We know that's starting to show now in the overall numbers of cases in the United States, but there is a bit of a delay. Canada and Australia, New Zealand and Japan still down the bottom. So they're new cases. Now, these are the cases by variant, and immediately we know that the United States is now on 75% Omicron. So we see that this is out of date. And we know that the United Kingdom is over 60% Omicron now, well, in fact, the UK now 71%, wasn't it officially? So we know that these figures are out of date. But we do notice that Australia is mostly Omicron. So this is going to spread very rapidly throughout Australia. And Australia have just got their vaccination programs done in time. It looks like Australia's going to do very well again, unless Omicron turns out to be very pathogenic, but we don't think it's going to. So they are starting to catch up there, but that data's still out of date, certainly as far as the United States and the United Kingdom is concerned. Japan, 8.1% Omicron. We've got to see an increase in cases in Japan, you would expect, fairly soon. But we haven't yet. Number of COVID-19 patients in hospital per million, United States. These are Delta cases in hospital. United Kingdom, these are Delta cases in hospital because we know that there's only 133 people in hospital out of 7,500 in the UK. So there's 7,500 people with COVID in the UK hospitals. Only 133 of those have been diagnosed with Omicron so far. Deaths, the United Kingdom deaths are going down. The United States, they have remained fairly high, but these are the effects of Delta. Ireland, the death rate is probably a little lower than the UK, roughly the same as the UK actually on average. Canada, Australia, New Zealand and Japan all on very low rates. So that's our sort of quick review that we like to do of mostly English-speaking countries. Now, UK data is under these links here. Do check it out for yourself. Now, South Africa. Let's just look at some South Africa data as well, starting here. Now, here we see the whole pandemic in South Africa. First wave, second wave, third wave. So the first wave was wild type variant. Second wave in South Africa was the then called South Africa variant, now called Beta variant. Third wave was the Delta variant. Fourth wave is the Omicron variant, and it's going down now, particularly due to the reduction in cases in Gauteng, although there are reasons for that we might see in a minute. But if this carries on, can you see we're looking at a very thin time period there. Now, how this is going to go, we don't know. It could end up being much wider. We simply don't know. But so far, it looks like cases are starting to go down in South Africa. But there will be a proviso on that in a minute. So that's cases in South Africa. Hospital admissions, first wave, second wave, third wave. So far, the hospital admissions are high, but we know a lot of these are incidental for Omicron. Increasing, but as we've said, they have had Omicron there for 4 weeks now at fairly high levels. Deaths in South Africa, well, there's a slight increase, yes, but very slight compared to the first wave, second wave, third wave. And bear in mind, we are a month now into this. And of course, we know that South Africa is now all Omicron, essentially all Omicron, 96% there. So let's look at the deaths there. 4 weeks into the fourth wave, into the Omicron wave, deaths are low. Hospitalizations are slightly higher, but cases are way higher. Now, is there going to be? Is it going to turn out that there's a longer lag time with Omicron? Is it going to be 6 weeks from people getting the infection to people getting ill? Could be, but so far we're not seeing it in the sort of time frames we would expect. Not yet, anyway. It really is a so far so good sort of situation. So Gauteng, 10,000 new cases, 8,000 new cases. I've actually got that the wrong way around. It was 10,000 new cases 2 days ago and 8,000 new cases yesterday. So the number of new cases going down in Gauteng. But there's some big municipal areas in the Gauteng area, so a lot of people are going home for the holidays. So that's what might be bringing the cases down slightly. So it could be slightly spurious. But anyway, Professor Tom Moultrie, this professor, not very good with names, University of Cape Town demographer, Moultrie. Is that Moultrie? Professor Tom Moultrie. It really does seem as if my country will escape relatively unscathed in this wave. Do hope Professor is correct. What if South Africa's light escape is because we bought that at the present at horrendous cost during the past waves? Well, could be, because we know there's been high number of natural infections in South Africa, and this is the big variable. As we know, the infections in South Africa are mostly natural infection, or the immunity in South Africa is mostly from natural infection. In the UK and the US, much more of it is from vaccine, but we do have data that shows that both are looking equally effective. So Johannesburg and Pretoria, so a lot of people in this, these are both in Gauteng, I think, they're going home for the holidays, for Christmas. Mostly in minibuses, which have a limit of 22 passengers. A limit which apparently is pretty well ignored. So you've got people going home from Gauteng with 22, 23, 24, 25, 26, 27 passengers in a minibus, guaranteed infection. But it's already all around South Africa anyway, so how much difference that will make is difficult to tell, because it is all around South Africa already. Now, Africa is a concern. Here is some data from Africa, which of course is hopelessly limited. So we do see that Nigeria, Malawi, Kenya, Zambia, of course we don't believe these figures. We know that in Nigeria there was a case a couple of weeks ago, so if Omicron is not all over Nigeria now, I would be amazed. Zimbabwe with slightly better testing, Namibia and Botswana, which has actually got pretty good testing as cooperations with South Africa. So we do see this great increase in African cases here. Now, I've got here that Africa could go one of two ways. Now, what's happening is that the cases are spreading around Africa, as we've seen. There's some indications that Omicron affects younger people more. We know that the amount of illness in South Africa has been, I think we can say, minimal. So far in London, it's looking like small amounts of hospitalisations, although, as we constantly have to say, that could change. But in Africa, in most of these African countries, the levels of vaccination is very low, and we don't know what the natural level of infection is. So it could be that Omicron is causing just as severe illness as Delta. It's just that we're not seeing it because our populations are so well immunised, either through vaccination or through natural infection. So one way is it could go in Africa is that there could actually be quite a lot of people getting sick in the next few weeks. But again, the provisional data we have is not showing that. And the other way that Africa could go is Omicron could run through, cause herd immunity absolutely everywhere in a couple of weeks, and the whole pandemic could go away. So it could go one of those two ways. Spreading in Eastern, Western, Central Africa, and these countries particularly, it's spreading. Now, I think we've got a report from Wefwafwa in Africa now. So let's go on to Wefwafwa's report from Africa now. I think we can do that.
Today's COVID-19 and Ebola virus outbreak updates. I will start with some exciting news. Now, the Minister of Health of Democratic Republic of Congo declared the end of Ebola outbreak. That is started around October 8th and it ended on 18th of December. Now, we know that Ebola virus is one of the causes of hemorrhagic fevers, and it is a very dangerous disease. So when I heard that it has ended, I was so excited, and that's why I felt like updating you, my friends. This virus or outbreak claimed around 9 people because they confirmed 11, but 9 people died. It has a very high fatality rate. So when it has ended, it is so exciting for all of us. I want also to give you some updates on the Omicron variant in East Africa. In my last update, Uganda was the only country in East Africa that had confirmed the Omicron variant. But as I talk, about 5 days ago, the Minister of Health of both Rwanda and Kenya confirmed their first cases of Omicron variant. And in Kenya, there were 3, and Rwanda, there were 6. In Kenya, cases were from the community. That means there is an evidence of community transmission. Now that Uganda is neighboring Kenya and Rwanda, there are high possibility that there will be the movement of those people from Kenya into Uganda, or people from Uganda into Kenya, and they will come back. So there may be community transmission of Omicron variant as per today in all these countries. In our previous address, we saw that the 7 cases that were confirmed in Uganda, they were all imported cases. That means there was no evidence of community transmission. But now that Kenya has, there's a possibility that in Uganda, we may be having it now. When you look at the number of cases that are reported daily in all these countries, the cases are increasing. So there may be possibility that the Omicron variant is the one that is leading to the rise in the number of cases reported daily compared to my previous update, as you will see the figures that I will display on the screen there. Also, there may be a possibility that since we are in a festive season. People are getting to mix a lot. We have people traveling from urban to rural areas, rural to urban. I mean, there is a lot of businesses that are taking place right now. People are extremely busy. So this may also explain as why there is a rise in the number of cases reported daily in these countries. Now, allow me go through some of the figures from these countries that I've talked about. Now, I will start with Kenya. Now, Kenya today reported a total of around 1,020 new cases out of 3,444 tests done as per today. When you look at the number of cumulative cases, Kenya has reported a total of around 264,727 cases as per today. Kenya has reported a total of around 5,353 deaths. When you look across all these countries, the death rate is still not very worrying. Let me go through the values for Uganda as well. So as per today, Uganda has not reported any other case of Omicron variant apart from the 7 that I reported in the last update. As per today, the number of cases in Uganda that they confirmed, the total new cases today actually they were 258 cases. That is very high for a single day. But it may be due to the reasons that I just spoke in the video. So the cumulative number is now 6,497. When you look at the positivity rate, it is 4%. It is low compared to the one of Kenya. When you look at the number of deaths, Uganda has lost around 3,274 people as per today. And the cumulative recoveries, we have recovered around 98,053 people. So those are the people who have recovered from COVID-19. When you look at the immunization, Uganda has vaccinated a total of around 7,888,584 doses of vaccines. In Uganda, we've not yet started giving the booster shots since many people in the population have not yet received their vaccines. Now, when you look at Kenya, they have administered a total of around 8,902,539 doses of vaccines, and majority of the people have received at least a second dose. So that was today's COVID-19 update. Thank you very much for watching. Have a good day, a good morning, a good evening, wherever you are watching from. I love you all. See you in the next update. Bye. Hello everyone, welcome to today's COVID-19.
Don't say it all over again, you've just said it once. Where are we? There we are, excellent, yeah. Right, okay, so good news there. The Ebola outbreak has been contained. Now, Ebola is a horrible disease. It's what you call a hemorrhagic fever. You just get bleeding into internal organs. So glad that's been contained. It's not transmitted the same way as COVID. It's more from body fluids. And now people know how to take care of the sick people well and dispose of the dead effectively. It's less of a problem. But there's always a risk of Ebola outbreaks, and it's a really nasty disease. Interesting. Vaccination increasing slowly in those countries, but no question now that Omicron is out and about. It's just not being picked up that much. So what will happen there in the next week or two, we don't know. I remain hopeful that it will cause more upper respiratory disease than lower respiratory disease. But in the Africa situation with lower levels of immunity, we don't know that for sure yet, so we're sort of watching that on a daily, well, several times a day basis, and of course we'll keep updated on that. But there you go. Europe, the United States, UK, Omicron is the now dominant variant. And I'm hopeful that this is going to displace the Delta, but we simply don't have absolute data on that yet, as the CDC says. But we do know a little bit more than they are letting on, and I hope that video helps with that understanding. I'm feeling fairly optimistic about this. I could be here grovelling in apologies this time next week that this is a deadly, horrible variant, but so far the data is not suggesting that. On the contrary, the data so far, and I stress the data so far, is indicating that this is milder, at least in vaccinated and previously infected populations. What we don't know so much about is how it's going to be in the Africa situation, but Wefwafwa's monitoring that closely for us. Now, on a completely separate matter, Wefwafwa and me have just managed to buy a bit of land in Uganda, and Wefwafwa's got someone to design a clinic, so we're going to start a clinic there shortly. So if you want to keep updated on that and follow Wefwafwa's updates, of course I'll put the link to Wefwafwa's site. I think it's fascinating, and there's going to be an update on the land that we've got for the clinic on Friday on Wefwafwa's channel, so watch that. And thank you for watching this one today.